Hi friends, welcome to the next episode of Every Minute is Precious Series. Today we're going to be having a look at a urine sample of a patient who's suffering from a condition that's given the name of PNH, paroxysmal nocturnal hemoglobinuria. Now the unique point about this kind of a hemoglobinuria associated hemolytic anemia is that this hemolytic anemia is an example of a intrinsic and acquired cause of hemolytic anemia. Why does that anemia take place is because the fact patients are having the presence of a PIGA gene defect. Thereby, the patients are having the blood cells which become extremely sensitive to the action of complement system. As a result of which, the patients are going to be having the development of hemolysis, which typically takes place in an exaggerated fashion in the night. The first urine sample, therefore, that is being passed by the patient happens to be of a dark colored, classically described in your questions as tea colored urine. So what you are observing over here on the left side is an example of a tea colored urine, and the sample on the right is an example of a control sample. Remember the fact these patients are going to be having normal cells in their body as well. Therefore, the diagnosis of the patients is to be done with the help of flow cytometry. As we have talked about in the main video section, the reason why the patients are going to be having the mortality is because of the development of hepatic vein thrombosis, that is Budd-Chiari syndrome. Now, once we have had a recap of this condition, I just wanted to answer for this particular question in the chat box at your earliest, which is the monoclonal antibody which is found to be useful for reducing the symptoms of a patient suffering from PNH. See you soon with another episode of the series.